Well, welcome to this talk. We're at the health camp Wefwafwa in Uganda. Give us some information about it.
Yeah, today is a very special day. We are here in Uganda, Africa, launching our organization, Wefwafwa Health Foundation, which came as a result of the combination of your YouTube channel and then my YouTube channel, and people who are following us around the world. So today we are launching it officially. It has gotten the national recognition. We had here the government officials, so we are launching it, and we wanted to launch it in a best way possible, and we thought that today we would make this day special by inviting all people who are sick, and we offer them free medical care. So that is what we are doing today here.
So we've had, I think, about 2,000 people here today?
Yeah, we have received about 2,000 people and above, because by the time of making the video it had just rained, so most people went away, but we have been with a lot of people here today.
Mm-hmm. Yes. And these are people who would have difficulty accessing medical care without this local facility?
Yeah, there are a lot of people who are staying in places that are very far from the health facilities, and also because most of them are poor and they cannot be able to afford medication. So most people have been staying with many illnesses for a very long time. So when they heard about this opportunity of free medical checkup and medicine, so they turned out to in large numbers, and people came from very far parts of this country, and we also have people within this very community.
Mm-hmm. And I know we've used an awful lot of antibiotics and antimalarials. So I guess we're seeing people with a lot of infections.
Yes.
And a lot of chronic malaria problems as well.
Yes, we have a lot of people with those conditions. Most of them are because they are poor, actually they end up taking low doses. So you find some people with illnesses for a very long time. So today at least we are trying to give them a complete dose, and we are trying to screen even those ones who have other issues that they didn't know that they have. Mm-hmm. So yeah, really we are trying to cover those people with antibiotics, some who have been with chronic back pains. We have someone who does with orthopedics, is also seeing them. We have those ones of dental problems. They are doing tooth extractions, they are doing other treatments that are related to dental health. We have those of eye department, they are seeing people with eye problems. We have those ones with the other complications, but we have here doctors and other specialists who are working.
And we're also doing a lot of screening, so we're doing cervical screening,
yes,
blood sugar screening,
yes,
hypertension screening,
yes,
and HIV also is still a problem here.
Yes. So we are doing a lot of screenings, including brucella. We are doing even typhoid testing. Those ones who have complaints that look like typhoid and they don't have malaria, they are trying to test them. All of it is for free, and many other tests.
So how is this financed today if it's for free?
This one has been totally financed, majorly by people who have been following us on YouTube. They are really doing a great job. If it was not by their help, we could not have done this today, I believe. So they are really doing a great job. We really thank them for doing this.
So this wouldn't have happened without the support of people who watch our YouTube videos?
It wouldn't have
and it's
happened.
Made that difference?
Yeah, it wouldn't have happened. I wish all of them I wish it was possible for all of them to come and witness this. They could have seen how this has been life transforming, because a lot of people have been in pain. Imagine living with tooth pain. It is really painful.
It's terrible.
So, yeah, it's terrible. So many people have been living with that for a long time. If you again go, you will find some people with abscesses in the mouth. So this is like a really huge opportunity for them, and that's why you see, even if it rained, they are still sticking around to make sure that they get the the possible help here.
And we're seeing quite a lot of children with fungal infections as well.
Yes. Yeah, there are a lot of children. We see those of there are those of tinea capitis.
Yeah, the tinea capitis.
There are those of tinea chloris, and then other fungal infections. And we have brought those medications for them as well. And we are not only doing that, but we use the chance today to talk to them about how they can prevent getting most of the common diseases, which we have been doing, but today they turned out in large numbers. So we use this opportunity to make sure that we feed them with information that will help them to live a healthy life.
And everyone here has been getting some health education today. Tell us about that.
Yeah, everyone here was getting health education. A lot of people, the young, the adults, they were all getting the information. But this is something that we've been doing. Only that we've been reaching very few people. Sometimes we could use the radio station. But today they got a chance of coming and really witnessing. It's really life-changing. I believe that when they live here, they're going to spread this message, and we are going even to have a health community out there.
So a lot of the things that have been taught today are basic, health improving, disease preventing strategies.
Yes.
Because one of the messages that's come out today is that most conditions are easy to prevent and easy to treat.
Yeah.
We've got clever doctors here as well who've come today, thankfully, for the more complicated ones, but the majority of things.
Yes. Actually, in our conversation when we were talking to them, we told them that about 70% of the diseases we face in this community can be prevented by some few, like with some small interventions. We don't need to do too much. There are some simple things that we may need to do, like teaching people about boiling water before drinking, teaching people about washing their hands after using the toilet, can prevent them from getting diseases like typhoid fever, which can complicate and even cause someone to die. So it's really helping.
And typhoid is a type of salmonella which can cause terrible
it has a lot
gastroenteritis,
of
awful disease. Yeah.
So people have been able to understand what we have been talking about, and we believe that this is really going to help this community.
And I think there's been some chronic wounds treated as well. There's been all sorts of treatments going on.
Yeah, they are working on wounds as well because we really bought enough medication, and we are even going to add as I talk. They are out of stock, some of them, but we are bringing. But we can't be able to do this without people supporting us really. But it's just amazing, and it's really unbelievable that you can be very far and cause a very big impact here.
So in the future, we hope to get government funding.
Yes.
But as of now, this is all funded by YouTube income and YouTube contributions.
Yeah.
It's amazing.
Yeah, it's really amazing.
Yeah.
So people who watch by mere watching our videos and watching the ads that are run on the videos, they really help a lot. Those who choose to subscribe also help a lot because then they are able to be notified and they follow our videos and they are able to see what is happening, and most of the people actually just send the money direct. Some people buy us a coffee, some people use Sendwave, and multiple ways of sending. But this has really been important. So YouTube has really helped, and people who are following us are really precious because even government could not have noticed us if we didn't have that income from YouTube to start this work, because we started using that income and now they are noticing us. We've not yet received the funds, but we have hope that in the future we may get the funds. But meanwhile, we are still relying on YouTube and people who follow us to still push us maybe until the time when other organizations, they may be international or the government, will come in and we carry this together. But I really thank them for sharing this burden with us. It has not really been heavy on us just because of them.
But it's been heavy on you. You've done all the work. I'm just, I've just waltzed in this morning.
Yeah,
last week. But you've done
Yeah.
You've known the work. So the publicity from YouTube has attracted the attention we needed from local government, national government, and outside agencies.
Yeah, it's really helping.
Yeah. And what's this building in the background? Why isn't it finished?
The building in the background is the one that we've been talking about, the guest house, for the people who will come and check on us, maybe to check on our
but why haven't you finished it?
And
should be finished. Why isn't it finished?
It's not yet finished because
why not?
We don't have enough funds at the moment.
Oh, right, okay.
Yeah, we don't have funds, and we had prepared for the camp, which was very important because we first consider life. Most of the cases, life comes back. Life comes first. The health of our people is a priority. So instead of putting money in the house, we first thought that we first help those ones who are dying in pain, and this is then maybe we never know if people send us more money, or in case anyone is willing to come in and support us, then we shall be able to complete this house, because in the meanwhile we shall need to use it as the office since we have launched the organization, but we can also organize some rooms to work as the clinic for some cases in the village, as we still think about what to do in the future.
But we've put some tarpaulins on the roof, so it's been okay today.
Yeah.
It's been functional, but it would be nice to
it
to
was
finish it.
functional, but when rain increased, it was a bit difficult because still water was coming in.
You can probably see the mud around it.
Yeah, so which
very slippery here,
which means that we need to complete it as
we need
soon
a
as
roof,
possible.
really, don't we?
We need a roof.
We need a roof. Yeah.
But so far, I want to thank all the people who have helped us to reach that stage, because it has not been easy, but just because of their support, we've reached that level. It's not easy.
No.
Yeah.
And we have government permission now for this organisation. It's all officially
it's
recognised.
It is officially recognized. We had people from the Ministry of Health who were here, and they have really appreciated what we are doing, and I promise that in future we may collaborate in many aspects.
And you have met the representatives from the local government, the national government, and the Ministry of Health today.
Yes.
Which has been, and they're all very, very pleased with what's going on.
Yeah, we met them. We've been able to discuss with them. We were able to launch the organization with them, so we made sure that actually on the time of launching, everyone was represented. You represented the international community of everyone who is watching, who has never been to this place. I think you can testify what you've seen on ground, but also we had a government official who also came here, and he has seen, he's also taking back the report. We had the spiritual leaders, and then we also had the locals around. So this thing belongs to, I think, the whole world. Yeah, we were all
so we've got local needs being met locally.
Yes.
We've got full involvement of the community.
Yes.
We've got official permission from local government, official permissions from national government.
Yes.
And we are empowering people to promote their own health.
Yes.
We're not giving aid.
Yes.
And the work that is being done here is all being done by local nurses, doctors, clinical officers. It's all the local community.
Yes.
We've just facilitated it, and YouTube has paid for it.
Yes.
So we are not giving aid, we are empowering people to promote their own health in their own communities. That's what this project is about, isn't it?
This project actually goes beyond just saying that we help people, because we cannot be in that position of giving aid to everyone.
No.
It's really hard, but we believe that if we teach people very well about their health and they take charge, they are able to be healthy, and they will be able to be productive, and be able to work, and they will live a healthy life, and they will be well, and their future will be okay.
Absolutely.
Yeah, so we are not trying to give aid, as we cannot be able to give like handouts to everyone.
No.
It's difficult.
No, it's not about we don't want a handout culture.
Yes, we just want to take the whole community as one person. So the person that we are focusing on is a community, and every approach that we introduce is to get to the community level. So every person is covered. We plan for the whole community. We move with the whole community. We want them to participate and be involved in everything.
And if we have good health, we have healthy families, we have economic production, everything goes with that.
Yes.
What I'd like you to do now, Wefwafwa, is thank people for watching this video.
Okay, so I want to thank you all for watching today's video. Thank you very much for all the support that has enabled us to do whatever you are seeing in the background, and I believe Dr. John will upload maybe more videos where we will be able to see what happened today. And even on my channel, I will be able to upload some more videos. So just check it out. Thank you very much for watching and always supporting us. See you.
Thank you for watching.
Yeah. Thank you.